I'm Steve Schroeder. I'm a professor of medicine at the University of California, San Francisco, where I direct the Smoking Cessation Leadership Center. And it's a pleasure for me to talk a little bit today about smoking and what it does. So, of all the things that people can do to hurt their health, smoking is probably the worst, except maybe jumping out of an airplane without any parachute. Smoking accounts for about 540,000 deaths per year in the United States, and it causes heart disease, cancer, stroke, and a variety of other problems. A lot of people are confused about why smoking is bad for you, and they think that it's the nicotine. But actually, it's the 7,000 other compounds in combustible tobacco smoke that include 69 that are known to cause cancer and a bunch of other things that cause other kinds of problems, including carbon monoxide, which inhibits the ability of the body to deliver oxygen to your organs. People who smoke die on average about 10 years earlier than those who don't smoke, and the death can be really kind of miserable. Now, what about using the nicotine? What nicotine does is it gets to your brain and it liberates dopamine, which makes you feel good. So it habituates you. And when habitual smokers don't smoke, they get actual withdrawal from the nicotine, and it makes them crave smoking. So the use of nicotine as a replacement therapy is okay to do, and it won't cause you cancer, heart disease, stroke, all those other kinds of things. So I've up till now said a lot of bad things about smoking, but there have been some very encouraging trends. One trend is that compared to my parents' generation, and I'm a lot more senior than many people watching this, virtually half of the country in the United States was smoking in the 60s. Today, that number is down to only 14% of adults are smoking. Now, there are tremendous differences. In some parts of the country, like in California, the rates are very low. We're down about 11%. In other parts of the country, like in the Southeast, Alabama, Mississippi, Kentucky, North Carolina, Indiana, West Virginia, the smoking rates are much higher. The other thing that's happened is that smoking is now allocated by class. So you're protected, you're less likely to smoke if you're better educated, if you make a decent income, if you have a full-time job. And people with higher smoking rates are those who have psychiatric illnesses, who have substance use problems such as heroin or cocaine, and people who are in jail and are homeless, and people in the LGBTQ group. So that's an issue. A lot of you have probably been reading recently about e-cigarettes and wondering what these are. These are devices that heat and aerosolize a nicotine vapor, which goes into the pharynx. Generally, the particles don't get into the lung, and they deliver the nicotine to your brain pretty quickly. And so people use them, kids use them, adults use them, and they've ignited, no pun intended, but they've ignited a huge controversy. So a lot of people are worried about e-cigarettes because they fear that there'll be a gateway to youth, that as youth will experiment with e-cigarettes and then move on to smoking. Turns out that on balance, that's not so true, because while e-cigarette rates have gone up, the use of combustible cigarettes by young people has actually gone down. The other thing they're worried about is that they will become addicted to the nicotine that's in the e-cigarettes, and that's a real concern. And nobody knows quite what the consequences of that are, because the e-cigarette use is relatively recent. E-cigarettes may come in flavors, and there's some concern that the flavors will seduce young people into trying them. The counter-argument about e-cigarettes is it looks like they may be useful in helping adult smokers quit. Most adult smokers who quit want to quit, but they find it a hard time doing it because they don't want to give up the use of the nicotine. So if you can get a substitute, and there are FDA recommended substitutes, including 5 different versions of nicotine replacement therapy and 2 prescription drugs. Those work, but they only work on a minority of smokers. So the average smoker, it takes them 10 to as many 30 attempts to quit smoking. So it's hard to do. If you know people who are trying to stop smoking and they don't make it the first time, encourage them and say, way to go, try again, because you're going to get there. And the good news is that there are now more ex-smokers in the United States than there are current smokers. With the advent of e-cigarette use, there has actually been an increased rate of smoking cessation in the population and a decline in the previous trend of who it is that's smoking. There have been very few if any, randomized controlled trials on the use of e-cigarettes as a way to help smokers quit. There's also some confusion in that both adults and youth who use e-cigarettes tend to be sensation seekers, people who are trying new things, and they may be more at risk of other things. That doesn't necessarily mean that the e-cigarette use caused them to do the other things, but that's an issue. So this is an interesting time for smoking. The good news is that with the decline in smoking prevalence, many few people are smoking, and those people then won't get the illnesses that smoking causes. The interesting thing is that e-cigarettes, and in particular the product Juul, have come on the market. They tend to be popular, and we're not quite sure what the consequences are. So what you can do is, first of all, don't smoke. Secondly, if you do smoke, try to quit. Thirdly, if you know people who smoke, get them to try to quit. Get them to call the quit line, which is 1-800-QUIT-NOW, or in California, it's 1-800-NO-BUTS, BUTTS. Get them to talk to a counselor there. See your doctor, get counseling, use one of the 7 recommended ways to quit smoking. It's the most important thing you can do to improve your health. And I want to now do a shout out to Breathe at Berkeley, who is hosting this, and I want to say, go Bears. Thanks for listening to me, and may you be healthy.